All right. Well, thank you all for joining. We still have some people that are getting in. We're going to kick this off because Anthony does have a lot of great content to share today. I'm Justin Rowland, the Vice President of National Sales at PharmaForce. Thank you all for joining. If this is your first time, we appreciate the attendance. We do these every month. It's 30 minutes, and we give really content that is applicable to the 340B industry. As you can see today, we're doing the state of 340B in 2024. And everybody's returning guests, we certainly appreciate your continued presence on these webinars, and thank you for the attendance. Anthony's will do he'll do a presentation. It's 30 minutes, and then we'll leave it open to questions in the end. If you want to ask questions while you're thinking of them, if you'll go to the chat box, you can enter those questions, and we'll address them after Anthony's presentation. And with that, I'll kick it over to the great Anthony Velasquez.
Justin, thank you so much with your AI generated picture on the screen. Appreciate the introduction. Again, thank you so much for joining. This really means a lot to us. My name is Anthony Velasquez. I've been in the 340B space for over a decade. Worked for several covered entities prior to joining the third-party administrator side about 6 years ago. I managed programs at FQACs, dish entities, etc. Then I got into the tech world. This is my first time using my standing desk. It was my 2024 health kick goal. So I hope you guys don't mind the view, but I'm standing here, and this should be fun. I got a lot of content to share. Going to do it in 30 minutes. That's the goal, is to have these short educational filled sessions. 340B is not boring. It has not been boring every year that I've been in it. So let's start with what's going on in the state of 340B, what's expected in 2024, what are some of the big developments. There was a lot to choose from. So I hope I picked the right stuff, and you guys enjoy it and participate and ask questions and all that good stuff. All right, so rule number one that I always share when we do these webinars is nothing in this presentation should be constituted as legal advice. Okay, I have to get that out there because I love going into the weeds about managing 340B programs, and I don't want to get myself in trouble. I don't want to get PharmaForce in trouble. All right, so that's rule number one. So please remember that. Then I have rule number two. Rule number two is, remember rule number one. Do not use anything in this presentation as legal advice. This is just information that we have taken, that I've studied, that I looked into, and I'm just sharing my perspective on how it applies to the world of 340B. All right, so here we go. We have a really diverse crowd. We have every facet of 340B that has signed up to join this webinar. So we have entities, wholesalers, TPAs, we have manufacturers, we have lawyers, and we have everything on here. So let's go ahead and get started. I'm going to cover the 5 areas that I think we're going to see the biggest developments and movements in 2024. Some of it, the first 2 weeks of the year have already been full of action. I'm going to talk about the patient definition as number one. I'm going to go into manufacturer restrictions because that seems to be, there seems to be new news in that realm almost weekly. I want to talk about the state level legislation. There's a lot going on in there that I'm not sure that everyone is really in tune and paying attention to, but there's some really good stuff going on at the state level. I want to talk about the 340B provider reporting bills. Those are new this year, and that could have implications for covered entities at a state level. And there's been some congressional discussions about it as well. And then the congressional outlook is what do we expect this year our Congress to do as it relates to 340B? Hint, not much maybe. All right, so here we go. The future of the patient definition. So as some of you might know, if you're in this space, right at the end of the year of 2023, it was November, we got this huge news that a ruling that was expected on this case of Genesis Healthcare versus HRSA, that a ruling had been passed. Funny story, Justin, I think one of the representatives, or I guess someone that works for Genesis Healthcare, I think signed up to our webinar, so they're one of the participants. Hopefully, we've been talking about you and your health center for a couple of months now. So what is this about? If you don't know, I'm going to do a quick background on what happened. So there's this FQHC, Genesis Healthcare in South Carolina. They were audited in 2018, and they have some diversion findings. And essentially, what HRSA said is, you have prescriptions that are 340B eligible that are not from a eligible location or provider. They were not from a service resulting in the prescription. So that's what HRSA said to Genesis, and gave that covered entity diversion findings based on that merit or that understanding. So Genesis said, hey, we're going to take you to court. That's not how we see it. We think that we're abiding by the patient definition as intended in the 340B regulation, and have been in this fight against the government since 2018. On November 3rd, a ruling came out that basically granted Genesis a summary judgment. So they essentially won the case, and the court sided with Genesis, saying that the only statutory requirement for 340B eligibility is that the person be a patient. There are tons of questions of what is a patient now that sort of were opened up with that case, and are yet to be answered, I will say. And essentially, the courts found that HRSA's definition or patient guidance was unenforceable, and it wasn't consistent with the language. So that was a very interesting, and a case that many people had eyes on and were looking at, and were hoping for a ruling that many thought would change the landscape of 340B for many years to come. So that's sort of the facts of the ruling of basically what happened. Of course, that is a 50,000-foot level view. There's a lot of more details on the specifics of that ruling. So what does this mean for 2024? So what does this mean for entities? Here's a few things to note. Just recently, the 60-day timeframe expired for HRSA to appeal the decision. They decided not to. So the federal government decided they are not going to appeal the decision. Since they're not going to appeal the decision, and most likely meant that they didn't think they could win an appeal. So that was very interesting. I think that was announced like the first week of January, that they would not appeal that decision. Now, I have a very interesting take on this that I have not heard others share, and that is, many people are thinking that this changes the whole landscape of 340B, that this basically is going to open the floodgates for entities to now move from a prescription-based capture to a patient-based capture logic. However, I have a little bit of a different opinion on this. I think this may actually end up hurting covered entities in the short term. Manufacturers seem to be emboldened by this. The talks in the 340B space are that now entities can change their patient definition and just capture anything from a patient, as long as that person was a patient, and that being a patient could mean had a visit at the health center in the last 3 years, right? So there's a lot of gray in that area. But I think this ruling may hurt providers further, because manufacturers are feel emboldened, and you can tell by the way of the aggressive push for further restrictions from manufacturers in 2020, at the end of 2023, and even already in 2024, there have been some further restrictions. So that's sort of my take on it, sort of at a macro level. In the short term, in the long term, I'm optimistic that providers will that the 340B laws will be cemented, and that contract pharmacies and the provider's ability to provide 340B prescriptions to patients will pass and will be made into law. So I'm hopeful for that. I have no insight into that, but I'm hopeful and optimistic. I just prefer to have that point of view and that outlook in life. Now, there's also a divide among providers, as I was sharing. So there's the camp that says, hey, this is it. This is the ruling that opens the floodgates, where let's change our patient definitions. Entities can now capture every prescription at a patient level, as long as that patient meets the patient definition. Again, a very broad statement of who is a patient. And And then there's the other camp that says, hey, this really applies to just Genesis, and many folks think that it's clear that the decision only applied to Genesis Healthcare, the entity that was in the decision, and not every 340B entity that chooses to change their patient definition. In that, I shared this in November that I expected HRSA to post something about this, and we were waiting for some clarification. And they posted a new patient definition compliance resources page on their website. Now, there's nothing new. So if you go there and are expecting to find something new, there's nothing new. It is essentially just restating that what HRSA is using to audit covered entities is the 1996 patient definition guidance. That has not changed. If you are being audited or receive a HRSA audit letter, as far as I know and we know, that will be conducted based on the 1996 patient definition guidance. Now, what's going on in the field? Are entities truly changing the way they capture claims? I'm not seeing that. We're seeing questions, we're seeing concerns, we're seeing legal review. Justin, jump in here. I don't know if you're seeing something different since you talk to probably even more entities than I talk to on a day-to-day basis, but I'm not seeing a change or a push or any sort of significant move away from what we understand to be a patient in our world.
Yeah, Anthony, the discussions there quite often that they're going. Some of these CEs are looking at capturing claims based off this Genesis ruling and changing their patient definition, their policy procedures of what they do and how they capture claims. But I don't hear it. I don't hear it as often as I thought I would.
Yeah, same here. Same here. All right, cool. Now let's talk about the biggest story. So I think this one and Genesis are 1 and 2 as the biggest story in 2023, and will continue to be in 2024. And that's the manufacturer restrictions. They continue. They continue to come on, and I guess it feels like it's weekly. So what's the latest? We're now up to 29 manufacturers with restrictions, some level of restrictions all over the place, with all different sorts of criterias and things like that. Already 2 new restrictions in the first 2 weeks of 2024 were announced recently by 2 manufacturers. In 2023, there were 20 plus new updates or new restrictions. So either a manufacturer that had never provided added a restriction, I think there were about 10 of them, and then other manufacturers who basically said, hey, the first notice that we posted, we're updating that, and we're further restricting 340B access. So this continues to be a big trend in the 340B space. Unfortunately, it is extremely burdensome. I don't think people understand, unless you're an entity, how difficult it is to really keep up with all of this. From just a practical and operational perspective, it is so difficult to keep up with every single manufacturer restriction, with every single list of NDCs that are blocked versus entities that are allowed, versus going on the 340B ESP portal, managing your orders, looking at your catalogs. I mean, it is extremely burdensome, and unfortunate for many providers and entities that are facing this. And the impact continues to be felt. I think the impact, the financial impact to providers in a day and age where they're facing many macroeconomic challenges, from employee retention to reduced reimbursements, et cetera, this continues to be just a really big financial hurt on covered entities and providers across the board. Now, what do we expect in 2024? Sadly, more restrictions. I think the Genesis ruling with HRSA basically not having any authority in many ways. I think more restrictions are likely to come. I hope not. I hope that I'm wrong, and I hope that there's some things that are loosened up. There's a ruling in 2 appellate court cases which will be groundbreaking, and I'll talk more about that in a little bit. But there's these 2 appellate court cases related to contract pharmacy that are expected to rule. I mean, I don't know why they've taken so long, but We're expected to get a ruling on that at some point this year, and that could change this entire thing overnight. So really, really curious to see what the outcomes of that will be. And there are more battles between states versus pharma. So states are stepping up as being the ones that are actually stepping up to help entities and to help providers in the fight against these restrictions. All right, Justin, anything you want to add to that in terms of what you're hearing from a manufacturer restrictions perspective?
No, just a lot of frustration in the field. Frustration with, like you said, these CEs are expected to follow these guidelines. A lot of times their TPAs aren't helping them. They don't have the support, the FTEs to really handle this. A lot of people are reaching out to consultants to help them through this. There's some really good consultants out there, and so they reach out to them to help them through this process.
Yep, yep. All right, now the states. So the states are really stepping up. They're really stepping up big time to help entities here. I think, I think this is it's an imperfect strategy, but I think it might be effective and it might work. So here's what's going on. So states are leading the fight against manufacturer restrictions. What does that mean? There are states that are passing legislation in their state legislatures, basically preventing manufacturers from these restrictions applying in their state. We expect to see, some experts expect that a third of states are going to introduce some sort of new legislation in 2024. We've already seen some really good news from several states as it relates to this and being successful at it. It has come with more legal battles, and that's sort of been the theme of, I think if I would say a theme of 2023 has been court cases galore. Lawyers are making a ton of money in the 340B space. Many states are awaiting further developments in those cases where there's pharmaceutical companies versus the states, where pharmaceutical companies are challenging the states, basically, their power to do this. There's a major decision pending in Arkansas that is expected and could embolden states to be more bold and quickly bring legislation that will be provider friendly and ensuring that entities are able to access 340B prescriptions and medications for their patients, and that their patients are able to access those medications. Really great graphic from our friends at 340B Report. If you're not subscribed to them, I highly recommend. Their content is really, really good. Tess Lasky and that team, they do a great job. But here's what we're seeing. Here's the latest. Arkansas and Louisiana were the first two states to successfully pass this. There's some litigation going on and stuff like that, but those have been successfully passed. In the yellow, you'll see introduced bills, and in the teal green, you'll see a bill that cleared the legislative chamber. So there's talks that entities are moving towards this approach, and providers are teaming up with their state representatives to really help in this battle against manufacturer restrictions at a time where it doesn't feel like HRSA and the federal government are doing anything to prevent the further restrictions. All right, now, the second thing that's really interesting, again, I don't know how much coverage this is getting. I haven't seen a lot of coverage in terms of understanding the implications of this. But the PBM underpayment prohibition laws are significant, and they seem to be ramping up, and there's been a lot of success. The reason why I bring this up, because I think that this is a successful blueprint for the manufacturer restriction fight, where states have been very successful against 340B reimbursement discrimination, where in certain states, PBMs were going to providers and saying, if you're a 340B eligible pharmacy, we're going to pay you a lower rate than if you're not servicing 340B patients, which is against the intent of the program. It's against the law. PBMs shouldn't be doing that, and that's very clear. But I guess they're attempting to get away with it until some of these legislations are passed. There's been 27 states that have enacted some sort of legislation against reimbursement discrimination in those states. So this is why I said I think this is a blueprint for the manufacturer restriction fight. The bills protect access to pharmacies and networks and prevent reimbursement cuts. So they prevent just a PBM from saying, hey, we just found out you're 340B and you're servicing 340B entities. We're going to cut your rates by 10-20%. So the bills prevent that, and I think that's good. Again, it's an imperfect approach, but it's very effective in protecting providers and entities. Again, 340B report has a great tracker on the laws that passed to prohibit PBM underpayments to providers. All right, cool. Justin, anything you want to add to that? Have you heard anything about that? Have you heard any entities really bringing that up?
I really haven't. I've heard
Yeah, I haven't.
different pharmacies that brought it up, but not entities.
Yeah, that's what I don't know that entities are too aware of a lot of those fights that are going on, just because the manufacturer restrictions are so big and so time
But the PBMs that have insight in the 340B have been collecting that data forever, and trying to find ways to cut, especially your independent pharmacies, and cut the reimbursement. And it's it's your, well, I won't name names, but we know who the big PBMs are and who they own. So.
No, I remember in 2012, I was working at a health center, and our mail order pharmacy, the PBM was asking them to tag 340, an identifier for 340B claims. This was in 2012.
I had the same thing in 2013 when I was with my FQHC.
So you just can't, and the thing is, you can't really notice it because it's really hard to know. I went from getting paid X amount of money on a drug to now it's 20% less. Like that's.
Right.
In practice, no one is really checking that, or very little entities may have the time to even check that. All right, cool. Another big development. This is brand new in 2024, and I don't know how big this is going to get, but there are now these bills that are basically provider reporting bills. So this is where states are wanting entities to provide information related to their 340B savings or their 340B revenue to the state. There have been talks about this at a federal level. So far, nothing has been done at a federal level. These have been state level provider reporting requirements. So what's going on with this? So from what we know so far, this seems to be an annual reporting requirement. So every year, once a year, your covered entity in certain states, again, not across the board, in certain states, will have to provide a report with certain metrics related to your 340B program. From some of the research that I've done, these are being called 340B transparency reports. Minnesota is the first state that has passed one of these bills, and it's expected that by April 1st, 2024, so in a few months, that entities in that state will have to provide these transparency reports. I don't know much about them. This is really interesting, and I'm looking forward to doing some more research on it. But essentially, what I have read is there's information related to 340B drug cost, reimbursement, payments made to contract pharmacy. So I'm assuming that's dispensing fees, number of 340B claims. Entities are going to have to be more specific about use of 340B savings. So if you are, bringing in X amount of money from your 340B contract pharmacy program, entities are probably going to need to prepare to basically say where that money is going. As we know, that's very difficult in practice, but there are some models where you can do that really well. I remember discussing a model at an entity I worked at where we had a dedicated bank account just for our 340B revenue, and money from that bank account will go to fund certain programs, new diabetes education, new provider, free transportation for oncology patients, etc. So there's some models out there you can explore, and providers should expect to see more state legislation on this. Justin, I don't know if you heard about this, but there's at least.
Absolutely. I could do a 30-minute webinar on just this slide, Anthony, on my thoughts on this, because if you think about just the general charity care that a large dish hospital does a year, this could be an opportunity for these covered entities to tell their story. Hey, this is why I need 340B. I'm maximizing my program, and I had $800 million in charity care this year. I made $800 million in 340B savings. And I mean, you can't operate when you're giving out so much charity care, but you can balance it against that 340B savings. And it tells a great story, right? So I couldn't survive. My hospital couldn't survive. I couldn't give away all this care without 340B savings. It's this could be a huge, I know it could be a pain for reporting wise, but it could be such a great storyteller for individual covered entities, and then roll it up as a state, take this information as a state, this template, and tell your story to your congressional members, your senators, your House representatives, and take that to Congress. Instead of trying to use one hospital to say, if you lose 340B, then this hospital is going to be hurting. You could tell a really good story with this.
Yeah, I don't think. Yeah, I guess I'm on the other side of that of like, man, this could open the floodgates to what other reporting stuff, right?
That's true. There's always another side of it, but
Right, but I see your point though. I see your point in that I don't think people know, especially even pharma, I don't think they really know how impactful, meaningful, and necessary the 340B program is for the healthcare industry in the entire country. And I'm not talking about for some, hospital in the middle of Mississippi. I'm saying across the board, if 340B went away, we will have a massive breakdown of our healthcare system. And I've been on the inside enough to know that that's a fact. That if you took 340B away, or even if you took it away significantly, as the manufacturer restrictions are doing, that will significantly hamper the program and will hurt real patients in these states and in these communities that they serve. So, anyways, that's my little rant for the day. But let's keep going because we have more to cover. Yeah, this is interesting stuff. Very interesting, new stuff. All right, congressional outlook. This is interesting because I see this question a lot, right? I think even at the 340B conferences, there's always some like presentation on what is Congress going to do this year, that type of thing, and rarely anything gets done. But will Congress act to protect 340B? My answer is maybe. I don't know. I don't think so. I try to be optimistic and look at this in a very positive way and say, hey, I believe in 340B. This program really helps millions of people and keeps the doors open at thousands and thousands of healthcare organizations across the country. It makes sense for this program to remain and survive and continue to help many entities. But there's major congressional gridlock. And unfortunately, that really has slow momentum on any bills. If you all remember, in the middle of 2023, at the 340B conference, we were expecting a bill to be introduced by a representative from California. That never happened. We were excited that it might even be introduced at the conference. That never happened. So unfortunately, if it didn't happen then, I think there's less likelihood that it will happen now. We're in an election year, a tough election year. I mean, they all are, but this one is on a whole nother level. So there's a short window. There's a short window any legislation to get passed. From everything that I read, it basically something needs to happen by July. If nothing happens by July, the year is done. From a legislative perspective, nothing gets passed. So there's a ton of stuff going on from debt and all these other things in Congress that I just don't see this happening. However, the two appellate court decisions, which I'm hoping they come out soon, and very quickly, because that's where all eyes are at. Everything that I've seen, even Congress men and women who are keeping their eyes on the case on the manufacturer restriction situation, everyone's waiting for these appellate court decisions and to see what happens. Because here's my thought process on this. If these decisions are pro-provider, so if these restrictions say the intent of the 340B program was for covered entities to utilize their access to 340B pricing at multiple contract pharmacies, and restricting that goes against the intent of the law. If that happens, then Congress may be able to just push this away and never do anything, okay? If the decisions are anti-provider, so if the decisions align with the court decision in January, which sided with the manufacturers, then Congress may be forced to act and protect the program, because if not, the consequences will be really bad. So that's sort of like my opinion on that a lot of it hinges on these two cases. Now,
agreed.
Yeah. So there's also that bipartisan group of senators that are working with stakeholders for legislative solutions. That's created a big divide in the 340B industry. There's some providers that teamed up with pharma and some lobbyists about proposing legislation. rumors are that some of that legislation favors grantees and not hospitals. I'm not in the weeds enough to comment either way, but I do think we're at a time where we need unity and for providers to be together and sort of this fight of where the 340B program is today. So all right, so we are right on the clock. 30 minutes. I'll get better than that. Justin, I'll turn it over to you to see if there's any questions. Anyone wants to jump in and have a discussion. We're more than.
We do have some questions, but I also want to remind it's the states are very important in this fight because the states empower the federal government. It's not the reverse, and so the states can step up and really and save these covered entities. And that takes the covered entities going to their representatives and senators and putting this in front of them. I mean, as you know, Anthony, I talk to my senators and representatives. I write them weekly. They get tired of hearing it. I'm sure seeing something from me, and I require a response every time. But it's who knows? It may help. I mean, I know it's some aide that gets it, but you never know if it's going to find the right person. So reach out to your people and keep this in front of them. Questions.
I'm glad you're saying that. Before you go to the question, let me just say that. I'm glad you're saying that because I thought about adding some content on that. Or what can you do? What are some action steps that you can do? Justin's absolutely right. Get your entity to be involved with, if you're a grantee, with whoever, with your lobbying group or your, the Health Center Association, hospitals, associated with 340B Health and others, supporting, seeing what you can do, talking to your representatives in Congress. Because all of that really matters at this time. And continue to educate yourself on what's going on because there's a lot going on. So continue to join these webinars, sign up to different, available content out there to continue to educate yourself on the matter.